Thank you everyone for joining us today. Our topic is going to be on American Heart Health Month, which is the month of February. I know we're coming to the end of the month, but we still want to highlight American Heart Health Month. My name is Jennifer and I'm a Symbol Health Coach. Before we get started, for attending today's health break, I want to make sure you will receive 25 points or 1 ticket if this incentive applies to your employer's program. To ensure that everybody is properly credited, we're gonna there's gonna be an attendance link posted in the chat. So please click that link and complete the instructions before logging off today. Okay, so we want to make sure everyone's getting credit for joining us today. So we'll go ahead and get started. So like I said, February is Heart Health Month. It was first recognized as Heart Health Month back in 1964 by Lyndon B. Johnson, just to urge citizens to combat heart disease. So it's been going on for a long time, and it's still an important topic that we still want to focus on, and definitely for the month of February. So just talking about a few heart disease facts, we wanted to highlight these. It is the heart disease is the #1 cause of deaths in the US. Heart disease accounts actually for 1 in 3 global deaths, but like I mentioned, #1 cause of death in the US. It's to be accounted for. Last I looked, I think I saw a few different numbers, but 695,000 deaths from heart disease in the US each year. Nearly half of all adults have at least one cardiovascular risk factor. So what is cardiovascular disease? So it refers to a group of disorders affecting the heart and the blood vessels. That develops when blood vessels become narrowed or blocked or weakened. It just reduces the blood flow. It can limit oxygen and nutrients reaching the brain. The group of disorders that affect the heart and blood vessels, of course, are coronary artery disease, heart attack, stroke. High blood pressure is also the group of disorders that's categorized under cardiovascular disease. Peripheral artery disease is underneath that grouping as well, which is just plaque buildup that narrows arteries, and that's usually in the legs, just reducing blood flow to the limbs. So there's several group of disorders that fall underneath this cardiovascular disease risk. So what are some major risk factors? I feel like a lot of people know this, but if you want to join in on the chat message, if anyone wants to guess what some major risk factors are, there's several of them. So I feel like a lot of people probably would know, but feel free to chime in the chat message if you think that you know what some major risk factors are, and then we'll go through those. Anyone? Smoking, yep, for sure. Smoking is definitely a major risk factor. Anyone else? And we're gonna, like I said, go through all of them. Once I start reading them off, you'll be like, well, obviously, obesity. Yep, that is definitely a major risk factor, 100%. So we know smoking, we know obesity, poor diet. We're definitely going to talk a little bit more about the diet and how it affects cardiovascular disease, or how we can prevent cardiovascular disease with that. Sedentary lifestyle, someone just said it. So physical inactivity, any amount of exercise is hugely beneficial for the heart. So a major risk factor is physical inactivity. Smoking, like we mentioned, inadequate sleep. Not necessarily maybe one of the first things that pops up in your brain, but inadequate sleep definitely affects cardiovascular disease. Being overweight, obesity, which we mentioned, or which y'all mentioned, high cholesterol, elevated blood sugar, and elevated blood pressure. So the American Heart Association recently updated its framework for cardiovascular health. It's focusing on 8 key measurable factors to improve heart health and overall longevity. So what those key factors are, of course, improving your diet, obviously, right? It is also, oh gosh, sorry. Did not mean to go back. I went back too far. Sorry about that. So you can see what those 8 key factors are at the moment. So we're looking at eating better, activity, of course, smoking cessation, sleep, weight management, controlling that cholesterol, the blood sugar, and the blood pressure. And those are called Life's Essential 8. So the first thing I really want to focus on that is a huge factor is nutrition and heart health. That's something that you can take control of immediately. And all of these things you can take control of immediately. But I wanted to focus on a few key factors with nutrition and heart health. There's a few diets, there's several diets out there, but lots of research has been done on these particular diets that support heart health. Mediterranean diet, the DASH diet, and plant-forward eating. Food choices directly impact your cholesterol, your blood pressure, inflammation in the body, your blood sugar. So again, I wanted to go through these specific diets, some or maybe all of them you have heard of. Let's talk a little bit about each one of these and how they can help with heart health. Mediterranean diet. So what this is a heart healthy eating pattern. It's inspired by countries like Greece and Italy. So it focuses on whole, minimally processed foods, emphasizes those plant-based foods and just overall healthy foods, which I feel like most people have heard of the Mediterranean diet. Again, a big focus on fruits and vegetables, whole grains, those good healthy fats. The fats are a huge focus on the Mediterranean diet. So really focusing on those heart healthy fats, those unsaturated fats, which are the olive oils and nuts and seeds and avocados. And of course, really eliminating or limiting as much of the unsaturated fats as possible, or much of the saturated fats as possible, which is things like cheese or bacon or sausage. Those really fatty meats can definitely raise cholesterol numbers. So it really focuses on the heart healthy unsaturated fats. It focuses a lot on fish and seafood, poultry, and of course using herbs and spices instead of actual salt. Okay, so this book, there's tons of books. If you go on Amazon or go into Barnes and Noble, there's tons of books about the Mediterranean diet. This particular book is a comprehensive guide that blends science-backed nutrition advice and practical meal ideas and recipes. It was written by a cardiologist and a heart health expert, and he really explains the core principles of the Mediterranean diet and shows how an eating pattern can support heart health, aid in weight management, and reduce the risk of chronic diseases. So there's lots of really good books, but this one is really good as well. And we're going to post some links in the chat as well for, I'm going to talk about several books specifically based on the diets that we're talking about today. And we can post those links in the chat for you as well. So the next diet I wanted to highlight is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This diet has been around for a long time. It was created and researched to help lower and manage specifically blood pressure. It focuses on foods high in potassium, magnesium, calcium, and fiber, which are all nutrients that play a role in the blood pressure control. And it's shown to support, of course, heart health and reduce cardiovascular disease. So the key foods, very similar to Mediterranean diet, fruits and vegetables, 4 or 5 servings a day, the whole grains, 6 to 8 servings a day, low fat or fat-free dairy, 2 or 3 servings, and of course, lean proteins, again, poultry, fish, beans, legumes, and then of course, healthy fats as well. Of course, foods to limit, it's going to really focus on the sodium. So it gives an actual milligram of the sodium. 15 to 2,300 milligrams of sodium a day is the recommendation for the DASH diet. Does anyone have any idea how much sodium is in a teaspoon of just regular table salt? Just to kind of give you an idea. Any guesses for how many milligrams of sodium in just a teaspoon of table salt that you would use to sprinkle on your food at the dinner table? Anyone have any guesses by chance? Of course, sodium's in everything. I mean, you can grow food in your backyard and there's some natural sodium in there, but I wanted to see, just get an idea. A lot, that's true. Yep, 2,300 milligrams of sodium in 1 teaspoon of salt, table salt. So the salt can add up really, really fast. You also find a lot of salt in the processed foods, of course, high saturated fat foods, such as, like I said, bacon and sausage, full fat milks. And then added sugars are also encouraged to limit with the DASH diet. Very similar to the Mediterranean diet. There's a ton of books out there about the DASH diet. This one was actually written by a registered dietitian. It's a practical, user-friendly guide. It takes that core research behind the DASH diet and really translates it step by step into a plan that you can actually follow. It does have some structured meal plans in this book. It's got meal plans for different calorie levels, recipes, some shopping lists, and tools to just customize this particular plan to your lifestyle. So we've included the link in the chat message for this particular book. Like I said, there's tons of books about the DASH diet. This one just has really good comprehensive information in there. And the last diet I really wanted to highlight, it's not really quote unquote a diet, but plant forward diet. So all that means it's focuses on foods from plants, fruits, vegetables, seeds, nuts, legumes, whole grains. And this really can range, a plant forward diet can range from predominantly plant-based foods to a fully vegetarian or vegan diet. It just emphasizes also minimally processed foods. Keep in mind though, when you go to the grocery store, not all plant-based foods are equal. So quality matters. There's a lot of plant-based, and I kind of use that in quotations, a lot of plant-based foods you can buy in the frozen section or at the grocery store, but some of them are really ultra processed plant foods and they're not going to offer as many benefits. So just be really aware, the more whole foods, the better. Evidence does show that this diet can lower your cardiovascular disease mortality, lower blood pressure, cholesterol, that bad cholesterol, and of course it's going to provide a ton of fiber and phytonutrients that help with inflammation and vascular health. There was a study done in 2023 in the Nutrition Journal that showed adherence to a healthy plant-based dietary pattern is beneficial for lowering the risk of type 2 diabetes, cardiovascular disease, cancer, as well as premature deaths for any diseases. So that plant forward diet has a lot of research behind it. This is, again, there's probably lots of books out there. This is called the Plant Forward Solution. This, again, is also written by a dietitian. It's a science-based guide written by a dietitian. Like I mentioned, it shows you how to center your eating around plants while still being flexible for some animal foods if that's what you choose. She explains the approach can really improve your gut health and your blood sugar and your heart health, and it does have all that information is backed by evidence in this book. There's meal plans in this book, grocery lists, recipes. The book is really great if you want to shift towards more vegetables and legumes and whole grains without feeling too restricted. It focuses just more on plants rather than eliminating certain whole food groups. It's, again, just focusing more on plants. And the link for this book is also now in the chat message if you wanted to check that out and read that book. So let's talk a little bit more about that lifestyle beyond the nutrition portion of this. So physical activity. We know that physical activity is healthy for you, right? Surgeon General's recommendation is 150 minutes a week of moderate exercise. So that's really exercise that gets that heart rate going, pumps, gets your blood flowing a little bit. So 150 minutes of moderate exercise per week. And then strength training is also recommended 2 times a week. So strength training can look different for different people. You can use, of course, weights or weight machines, but strength training can also be using your own body weight by doing push-ups or doing squats or doing some sit-ups. That normal, just using your own body weight. You don't have to use equipment, but any amount of strength training where you're utilizing those or building those muscles or maintaining that muscle mass 2 times a week is the recommendation for physical activity. Like I mentioned initially, sleep is another huge thing that we want to focus on. We've done whole presentations on sleep, so we know it's beneficial for overall health, but short sleep duration, which is meaning anything less than 6 hours a night, is associated with a higher incidence of heart disease, according to the American College of Cardiology. Chronic sleep deprivation increases inflammation and sympathetic nervous system activity. So we all know it's great for like a metabolic reset, just for overall energy, brain fog, all of the things, but it's also really beneficial making sure you're getting enough sleep for that cardiovascular health. And I wanted to just briefly touch on stress management. That's not necessarily in that Life Essentials 8 model that the American Heart Association put out, but Stress management, we all know that that can raise your blood pressure. Long-term psychological stress can really contribute to hypertension, systemic inflammation, increase the risk of heart disease and stroke. So just interventions such as exercise, mindfulness, figuring out what works best for stress management for you have been really shown to lower that blood pressure and some cardiovascular disease risk markers. So I wanted to make sure that that was mentioned as well. So, okay, lifestyle beyond nutrition. What is the single largest preventable contributor to heart disease in the US? Anybody have any guesses? There is one single thing that is the biggest contributor to heart disease and cardiovascular disease death in the US. Anybody want to give any guesses out there? I bet you can figure it out. There's one main single largest preventable contributor to heart disease. Feel free to type it in the chat message. I know someone will get this. Yep, you did it. Smoking is the biggest risk, preventable risk. It increases the risk of heart disease and stroke by at least roughly 2 to 3 times, which is hugely significant. Smoking and secondhand smoke exposure together causes over 480,000 deaths per year in the US. What smoking does is it accelerates plaque buildup and it increases blood pressure and heart rate. It promotes clot formation and damages blood vessel linings. So all the pathways for a heart attack or coronary artery disease and smoking, it accelerates all of that. So that is one huge preventable thing that you can do. I know as compared to, let's say, 20 or 30 years ago, maybe not as many people are smoking, but we have more vaping going on now, or e-cigarettes. There's definitely risks that come along with that. 19% higher risk of developing heart failure compared to those who have never vaped before. And that's according to one large study done by the American College of Cardiology. There's a lot more research really and truly that needs to be done for this, because these are new things that have come on the market over the years or over just the past few years. But we know that it definitely still has its risks that come along with that. And of course, there's smokeless tobacco, which is the nicotine in smokeless tobacco still poses measurable heart disease risk. So any amount of nicotine obviously is not good, whether that's from smokeless nicotine, smokeless tobacco, e-cigarettes, vaping, or regular cigarettes. And we've known that for a long time, but we definitely still want to push that factor there. One thing or it's a few numbers that I want to make sure that you know. If you go to the Symbol Clinic, or if you're going to see your regular doctor and they're testing your blood pressure or doing your cholesterol numbers or blood sugar numbers, I want to make sure you know what all those numbers are. So perfect blood pressure is less than 120/80. So if you're going into the doctor and they're telling you your blood pressure number and you have no clue what it's supposed to be, less than 120/80 is the ultimate blood pressure number. LDL cholesterol, which is your bad cholesterol, depends on the lab company, but we like to keep it less than 100 is the ultimate goal for that LDL cholesterol. Now, if you have a significant family history of heart disease, or if you've had a heart attack before in the past, the lower the better. Really, the guidelines for the LDL cholesterol, if you have significant cardiovascular history or family history, is really less than 70. So that bad cholesterol needs to stay low. Hemoglobin A1C. So what the hemoglobin A1C is, it's just an average of your blood sugar levels over the previous 3 months. So it's just measuring how much glucose is attached to your red blood cells. But that hemoglobin A1C, if you see that on a lab report, you want that number less than 5.7, and that's in a percentage. BMI, body mass index. So the body mass index is one thing we go by. The body mass index, what it doesn't do, it doesn't take into account your age or if you're male or female or muscle mass or anything like that. But guidelines for BMI or body mass index is between 18.5 and 24.9. And then waist circumference is another thing you want to know. Some doctors will do waist circumference, not always, but you can measure your waist circumference at your house if you have a flexible tape measure. The goal for women is less than 35, and the goal for men is less than 40 inches. If you, for men, that less than 40 inches, that is not your pant size. So your actual natural waist, if you know where the top of your hip bone is and the bottom of your rib cage, right in between those two markers, top of your hip bone, bottom of your rib cage is your actual natural waist. So if you're going to measure at home with a flexible tape measure, just know exactly where to measure. All right, so speaking of those life essential eights that we initially talked about earlier, how healthy are you? If you go to this link, and we're going to post this link in the chat message, what it is, it's my life check calculator to find out how healthy you are. It's just like almost a little quiz and get personalized tips to set your own health goals. So we're going to stick that link into the chat message. So you can click on that link and find out how healthy you actually are. And again, that's through the American Heart Association as well. And that's that Life Essential Eights. And so it kind of goes through and talks about how healthy you are based on your diet and exercise habits and all of that. So I want everyone to remember small changes add up over time. So we've talked about a lot of different diets and smoking cessation and all these things, but figure out a few things that you can start doing today that will make a difference. Some ideas: add 1 extra serving of vegetables today. Or if you tend to use more butter for cooking, try to switch over to some olive oil. That's a healthier fat. If you're not doing any exercise, now that it's starting to get hopefully a little bit nicer outside, not as cold of weather, and the days are going to start getting longer, take a 10-minute walk after dinner. You can, if you're doing a lot of sugary drinks during the day, add in a little more water to help decrease those sugary drinks. Cook more at home, less eating out. When you eat out, you're going to tend to get more fat and salt in your food. So eating at home more often. So any small changes actually add up. Like I said, I don't want you to feel like you have to make all the changes initially right now. These small changes, again, adding in some extra fiber and some good vegetables, those things are going to start working on cardiovascular health immediately, or smoking cessation, or cutting back on vaping. I appreciate everyone joining today. Hopefully you learned something. Again, feel free to always reach out to your Symbol clinic if you have any questions or concerns.